Good evening and welcome. Thank you for joining us tonight. My name is Luke Herbert. I'm the Director of Pharmacy at KSB Hospital. And thank you to Community Wellness for inviting me to present tonight. So tonight we are going to just review a bit about the 2024-25 COVID vaccines that were just recently released. So just kind of quickly, COVID is a respiratory viral infection, predominantly a respiratory infection that can affect other organs. Symptoms typically appear about 2 to 14 days after you've been exposed to the virus. And the severity of symptoms can be anywhere from extremely mild to such that you maybe only think you have allergies or a mild cold or something of that nature, up to severe illness and hospitalization. Symptoms typically include or can include fever, chills, cough, shortness of breath, fatigue, muscle and body aches are common, headache is common. Kind of unique to COVID is a loss of smell and taste. It doesn't always occur, but it can. Sore throat, congestion, runny nose, nausea and vomiting and diarrhea all can occur, or any combination of those things can happen with a COVID infection. So what's new with the vaccine this year? Kind of more about, I guess, infection rate. So obviously we're down a lot. COVID infections are much less common than they were during the peak of the pandemic in 22. But still they accounted for 245,000 deaths in 2022. Last year, around 76,000 deaths, which is still a very big number. I may add, we've had patients in the hospital being treated for COVID who require oxygen and antiviral therapy more days than not for the last 3 months. So there's been a decent amount of circulation through the summer, certainly more than was anticipated. And yeah, we've had patients in the hospital requiring, IV fluids, antivirals, and oxygen most of the days, 1 to 2, 3 people at a time over the last few months. So the newest recommendation is that everybody 6 months of age and older should get the 24-25 version of the COVID vaccine that's just recently been made available. A couple reasons to get the vaccine. Over 95% of folks who had to be hospitalized in 2023 had not gotten the fall vaccine. So the vaccine is good at keeping you from getting severe disease, keeping you from having to come to the hospital. The vaccine can help prevent you from getting infected and sharing or becoming contagious and sharing the virus with family members or those at work. And that's especially important if you have somebody in your family or in your circle who is maybe more vulnerable to severe COVID infection and possibly hospitalization. So the COVID vaccines are definitely one of the best, probably the best and safest way to protect yourself against severe illness and hospitalization, and just decreasing severity of infection in general. So the 24-25 vaccines, again, recently available, and as per previous years, same as last year, Pfizer and Moderna both have a vaccine out there, both based on the KP2 variant, which is a predominant variant circulating through the summer months. There's also a Novavax vaccine. The Pfizer and Moderna vaccines are still that RNA vaccine that was developed during the pandemic. The Novavax vaccine is developed in a similar fashion to most flu vaccines and how they've been made over the last few years. And that vaccine is based on the JN1 variant that was circulating last winter. Both those variants that the vaccines were based on are very, very similar to the strains that are circulating presently this fall. So when to get vaccinated? Now is the ideal time to get vaccinated. In particular, if you haven't recently had a COVID infection, the fall time and getting the newest variant is the best time to get vaccinated and to get a booster. 2 reasons. Number one, as we roll into the fall months, the air gets drier. We're going to start gathering indoors for for the holidays and possibly traveling, and all those things can contribute to increased circulation of respiratory viruses like COVID and like influenza. The second reason is because we have now available a booster with the current circulating variants, or based on variants similar to the currently circulating variants. The vaccine typically lasts about 3 to 6 months. Definitely effective for 3 months at reducing the risk of severe illness, up to 6 months, keeping you from getting severe disease or spreading COVID. If you have recently had COVID-19, say in the last 3 months, you can wait at least 3, if not 6 months before you get vaccinated, because you have some immunity built up from the recent infection. So folks that are at higher risk may want to go ahead and get the vaccine 3 to 4 months after they had COVID. Folks that are healthier maybe can wait closer to 6 months. Because, like I said, we know the antibodies from the vaccine have a duration of at least 3 to 6 months, and 3 to 6 months of effectiveness. COVID vaccine is very well covered by most insurances, and including Medicare. And it's pretty readily available. You should be able to find it at your primary care physician's office or at your pharmacy. You can get COVID and flu vaccine at the same time. That's what I'm going to do. I will probably have some mild side effects when I get the booster of COVID. Same when I get the booster of flu. Probably going to last about 12 hours. I'd rather just get that all over with at one time and maybe have 2 sore shoulders for, a half a day to a day. So you can definitely get COVID vaccine with influenza vaccine or with other scheduled routine vaccines. The only contraindication for COVID vaccination is a severe allergic reaction. So severe meaning you had to go to the ER, difficulty breathing, maybe a severe rash that occurred shortly after you got the vaccine. Other than that, side effects are different than an allergic reaction. Side effects are somewhat expected: soreness at the injection site, achiness, joint pain, slight fever, chills, nausea. All those things are fairly common. They can be pretty mild and last 12 hours, or maybe a little bit more moderate and last a day or 2. That's just symptoms of your body making antibodies to the vaccine, which is what we want to happen. They're not a cause for concern. If you've had significant side effects from one of the vaccines, you could just switch. So if you've had significant side effects in the past from like Moderna or Pfizer, you could just go get Novavax this time, or vice versa. And you may have less side effects with the other type of vaccine. How long should people wait after their most recent 23-24? So if you did just recently get the 23-24, anything that you would have gotten prior to about 3 weeks ago, or maybe 4 weeks ago, you could wait at least 2 months, maybe 3 to 6 months. You'll have antibodies from the 23-24 vaccine. The one big advantage with the 24-25 is that it's going to be a vaccine based on variants similar to what's circulating now, much more so than last year's vaccine. If somebody is pregnant, they absolutely should get COVID vaccine. COVID infection can be a severe complication or cause severe complications when you're pregnant. So that's it. Thank you for spending a little time to catch up on what's new with the vaccines, and find yourself a good day or 2 to get a vaccine at your local pharmacy or your primary care. If you have any questions, you can give us a call or check with your primary care provider. And have a great fall, and thank you.